Clinical presentation of a patient having asthma. A 46 years old woman named Haley came to clinic with a presenting complaint of dyspnea, wheezing sound on exhalation, and severe chest tightness, which can be easily felt on palpation. She also feels trouble sleeping since 2 months. She told that she is having episodic cough and a yellow sputum frequently during coughing, and sometimes she feels a sharp stabbing pain in her chest which makes her uncomfortable. Her symptoms aggravate when she encounters with things like dust, pollen, smoke, perfumes, etc. Upon asking, she also told that she feels the worsening of symptoms in cold weather and harvesting season. She told that her symptoms worsened with the physical activities like prolonged walking and stair climbing, etc. On examination, vitals: blood pressure 135 by 90 millimeter mercury, heart rate is 120 beats per minute, oxygen saturation is 92%, inspection: no obvious chest deformity, palpation, chest movements, chest expansions were reduced to some extent, auscultation, wheezing sound heard on stethoscope, assessment: wheezing sounds were heard, high-pitched whistling sounds with stethoscope during breathing, one of the main signs of asthma. Skin was examined to check eczema and hives. Chest muscles were observed to check any tightness. Diagnostic testing: CBC, that is complete blood count. It revealed white blood cells, especially eosinophils, were raised. Lung functional test, that is LFTs, they showed improved breathing after using bronchodilators. Allergy test, skin prick test were performed which showed positive results. Diagnosis is asthma. Treatment: Prevention and long-term control are key to control asthma attacks before they even start. Recognize triggers and learn to control them. Track breathing to check if the medications are helping to control symptoms. In case of asthma flare-up, use quick relief inhaler. And then there are medications: short-acting beta agonists, that is inhale quick relief bronchodilators, albuterol, anticholinergic agents like other bronchodilators quickly act to clear airways. Tiotropium, oral and intravenous corticosteroids, basically relieve inflammation caused by severe asthma. And then there is prednisone, that is corticosteroid. Physiotherapy management: chest physiotherapy. It includes breathing exercises, deep breathing, diaphragmatic breathing exercises, and then there is ACBT, that is active cycle of breathing. Removal of secretions through coughing and postural drainage. Nebulization: nebulize the patient with bronchodilators like ATEM or Ventolin to open narrowed airways. Spirometry: spirometry is used to improve patient's lung capacity. Posture: patient should be in tripod position while asthmatic attack. Both hands should be on ground with wide base and neck should be in forward flexion. It relieves breathing difficulties. Chest expansion exercise also improves air redistribution and oxygenation. And then there comes the goals. Short-term goals: stabilize the patient, prescribe the medicine with more effect and less side effects, remove sputum to improve breathing, improve the quality of life by focusing on breathing problems, quickly use inhaler to improve breathing, change your activity that triggers asthma symptoms. Long-term goals: reduce the risk to prevent the further worsening of asthma, control the symptoms for better quality of life. Home plan: number 1, avoid upstairs. Number 2, avoid spices in food and anything having spice in edibles. Number 3, avoid usage of perfumes as they can trigger the asthmatic attack. Number 4, try to avoid places that have heaters. Number 5, use quick inhaler if you feel any difficulty in breathing. Number 6, do at least 10 reps in 2 times interval of every advised exercises. Number 7, avoid overexertion. Prognosis of asthma is quite good. Therapies provide effective control on the symptoms of the patient. Follow-up. The patient came for follow-up. Dyspnea controlled after the patient followed the tips of prevention. Medication and physiotherapy also had good effects on symptoms and her condition improved. Feedback. The patient was satisfied with her treatment and her condition got improved after using inhalers and bronchodilators and physiotherapy. And here are the references.